I'm going to be showing you how to use the LifePack 15 monitor defibrillator and also do a test on the suction unit. So first we want to turn on the LifePack. You turn the green button here, press that on. That will turn on the LifePack. It will turn on in AED mode, so what we're going to do is press energy select and use a speed dial to enter manual mode. Press yes here, and for the purpose of this video we'll put this into 30 joules. So first we want to do a systems check. So for that we press the options button, get this lead out also, and attach the test load. It plugs in there like that. Use a speed dial, go down to user test, press user test, and the user test is now in progress. So while it's doing that, I'll show you how to test the suction unit here. So for the suction unit, we want it to have a minimum of 350 millimeters of mercury of suction. So to do that, what we're going to do is we'll turn it on. We'll turn on there, and we can include the tube here and watch the lights go up to 350 millimeters of mercury. So that's passed, and also we also want to check the battery here. So we want to have a full battery. If it's got a full battery, then the test is passed. Also, if it does not reach 350, we can always check all the seals around here to maybe troubleshoot why it's not reaching our minimum pressure. Alright, so we'll turn that off. And so the LifePack's finished its systems check. Should have printed something out here. I think it's stuck. But that says its user test is passed. So next we want to do a test defibrillation. So for that we've already got our test load plugged in here. So what we're going to do is press charge. It's charging up the defib, and so now it tells us to press shock. We press shock and the shock has been delivered. So for example, if we want to disarm this charged shock, we'll charge it up again. And then at this point, instead of pressing the shock button, we press speed dial down here and it disarms the shock. So next, if we want to use the leads, I've already got them attached to myself here. So we'll press the lead button here and it will show us the different leads. So at the moment it's got lead 2, showing us lead 2 across the top. We can also change the leads down here. It's got 2, 1, 3, and it will show us in the graph along there. So for now we'll leave it in lead 2. So for this we can also change the volume. So that we'll press options here, we'll go to alarm volume and we'll turn that up to the max. And we can also change the volume of the QRS. So we use a speed dial, go to the heart rate across here, press on that, put QRS, and that puts the QRS volume up. So we always want to have this up, so if you're not watching the patient, you can hear if there's any change in their heart rhythm. We'll just turn that down for now. Back to home. You can also change the amplitude of the graph here, so we press size. It gives us a range of sizes along the side here, and it will up to 4, so it can make the graph bigger. So say if you cannot see the QRS line across the screen. And lastly, the LifePack also has the ETCO2 across here on the side, and that plugs in to this little hole over here on the side. Just turn that in there. And as you can see, it comes up here on the screen. So we have here an oxygen mask. You can identify an oxygen tank. Sorry, you can identify an oxygen tank because it's usually a white tank. It will have oxygen written along the top here. And you've also got this little tag here which will tell you whether it is full in use or empty. So it's quite handy to use. So using an oxygen tank, you will use a regulator here. Now, regulator controls the flow rate of the oxygen and also tells you whether the tank is full or empty. So the regulator has a Bodox seal in it on the inside here, which is always good to check because the Bodox seal is what prevents any oxygen from escaping. Just makes a good seal. So to put this on, it's got 3 pins. So we've got 2 pins on one side, 1 on the other. Pop that over the top. And we tighten this side so we get some resistance, do a quarter turn so it's on there nice and tight. Make sure the flow rate is on 0 and we can open the valve and it will show us along the dial here that the oxygen tank is full at the moment. So that's good to know. It's always good to check this before a shift so that you know your oxygen tank is full. So now using the oxygen tank, we've got here a acute mask. So you want to use an acute mask in a patient who is in need of some extra oxygen, so maybe if they have low oxygen saturation. What we do is we put that on here, and with an acute mask it will run at about 6 to 8 litres along here, so we want to change this dial to put it on 6 litres per minute, and then that will deliver about 60% oxygen to the patient. So, is it alright if I put this oxygen mask on here? Or attach it on there. Just like 6 behind his ears. Is that comfortable for you? And then the oxygen will flow through the mask for the patient. Okay, that's great. I'm just going to take that off you now, sir. Take off the oxygen mask. And then we turn it off. We turn off the flow rate to 0. We then close that and take off the mask. And then now to get ready for next use, all we have to do is depressurize the regulator here. So all we do is turn on the flow rate and lets out all the excess air. So when we have an unconscious patient here, we always want to make sure that we have the Yankauer close by just in case the patient may vomit. Oh, it looks like he's vomiting. I want to put him in, turn him over laterally into the recovery position, just so that most of the vomit is able to get out of the mouth. I'm going to turn on the suction machine, and I'm going to place the Yankauer as far into the orophage as I can see. I want to occlude the hole and then suction as I come out. I don't want to do this any more than 10 seconds. Also, when doing that, I want to be careful not to cause any damage inside the patient's mouth. Alright, next I want to maintain the patient's airway. I can do this by first performing a head tilt chin lift, just to open the patient's airway. Then, to keep the airway open, I can use an OPA. So an OPA is indicated in a patient who is unconscious. So usually an unconscious patient may not be able to maintain the airway. So to do this, we measure it by placing it by the edge of the mouth to the edge of the mandible. So this is the correct size for this patient. So to insert it, we put it in backwards. Be careful not to scrape the palate of the mouth. It's very sensitive. Turn it around 180 degrees as you reach the back of the mouth and place it in behind the tongue. So what this does is it keeps the tongue off the back of the throat, just so that it keeps the airway open and air is able to flow. So this will be indicated in a person who is conscious, someone who has a gag reflexes that can induce them to vomit, or someone whose airway is occluded, their mouth is occluded, has got something in there, or they've got trismus where their mouth is shut tight. In this case, we can also use a nasopharyngeal airway. So with that, this goes through the nose, opens the airway that way. We measure this the same way. We place it at the edge of the nostril to the mandible, like so. That's the correct size there. First, we want to lubricate this one, just so. Yeah. We want to do this because the nasal airway is very highly vascular, so it's quite easy to cut. We don't want to cause any bleeding inside the nose there. So this makes it slide in nice and easily. So we want to put it in perpendicular to the face, just like that. Gently slide it in. If we get to any resistance, just turn it slightly. Or alternatively, we can also use the other nostril. Push that in all the way. So an MPA will be contraindicated in a patient who has a suspected basic skull fracture, as this may cause the MPA to enter the brain. So we've maintained the airway. We can breathe for a patient who is inadequately breathing. So for that, we can use a bag valve mask. So with a bag valve mask, we want to first check that everything is got no holes or anything, especially in the reservoir. So we can place that on the other end, like so, and pump up the reservoir. And as you can see, it's got no holes in it, so that's good. Place it the other way. We want to make sure everything is correctly put together, working fine. So with the bag valve mask here, we want to attach it to oxygen. So we place it here on the reservoir end, and we turn on the oxygen tank. And so with this, we want to use about 10 to 15 litres of oxygen, so we'll put it on 10 there, and this will give us an oxygen rate of 98% when we direct the patient. So using this bag valve mask, we place it on the patient's face, like so, using a C-grip. We get a good grip on the face. We can so we can keep a good seal because we don't want any air, pardon me, any air escaping through the mask. So ventilating the patient, we want to ventilate every 6 to 8 seconds. 1, 2, 3, 4. And we want to watch for tidal volume. As your tidal volume is going to be about 7 to 8 millilitres per kg, and also you want to watch for chest rise here. So you can see you've got the chest rise going up. Also, while doing this, you want to make sure you want to watch that you're not getting any gastric inflation. Gastric inflation is when the stomach is getting inflated because the air is going through the esophagus. To stop this, we can get someone else to apply cricoid pressure. So that's just down here. And what they do is they push down on the cartilaginous ring of the trachea, which pushes down on the esophagus and including the air from, stopping the air from going down into the stomach, so it's going to stop vomiting. We have a patient here who has a catastrophic hemorrhage on his distal thigh here. So firstly what we want to do is we want to expose the wound, get that up here. And because there's a catastrophic wound here, this patient is bleeding profusely, we want to stop him from exsanguinating. So to do that we have a tourniquet here. We want to apply that tourniquet 10 centimetres proximal to the wound, so up here. We want to tighten that up as tight as we can. And then we want to tighten this windlass here, twist that around, usually about 1.5 times, until either the bleeding from the wound stops here, or we can no longer feel a distal pulse. So I can no longer feel distal pulse and the wound has stopped bleeding here. So if the wound continues to bleed or you can still feel the pulse, what you can do is you can always apply a second tourniquet proximal to the first. It's also important when you apply these is to make sure you take note of the time and then write the time down on here. So also applying a tourniquet, what it does is it starves the extremity of any oxygen and nutrients. So the leg will be, in this case, will be very hypoxic, which is going to be extremely painful for the patient. So what you can also do is eventually you will offer analgesia to the patient here. So next what we want to do is we want to dress the wound. So we've got the wound here exposed. So what we want to do first is make sure if it's still bleeding, we can always pack the wound. So we can use dressing and stuff that in the wound there, just applying pressure. It's going to stop any further bleeding, but we're fine now. So what we want to do now is clean the wound, make sure there's no foreign objects in here, get any bacteria, anything like that out of the wound to stop it getting infected. Alright, so next we want to cover the wound with a dressing small enough just to cover the entire wound. So pop that over there. Then we want to get the dressing here, the bandage. Put that over. And what we want to do is make sure this is on nice and tight on the wound, applying pressure to the wound so it aids with the clotting process. So and way we can do that is we can twist the bandage here, and that's over the area of the wound, which is going to apply pressure to the wound. That's going to stop any further bleeding and then also help with the clotting of the cut laceration there. So also another thing you may want to do before applying this bandage is you can take a photo of the wound. So taking out and then you can, when transporting this patient to ED, you can show the ED staff there the picture of the wound. And this is going to prevent them, because they're always going to want to take this off and see the wound, but if they can see the wound, you can show them the picture and you will, they won't disrupt the clotting process. There we go. What has happened here, sir?
It's not so hard.
Okay, looks like I'm going to expose his arm here. Looks like he's got a bit of swelling and he's complaining of soreness in this area. I can see it looks a little bit deformed, so maybe he may have fractured his radius or ulnar, maybe both. So first, before splinting, I want to ask him, what's your pain out of 10, sir?
About 9.
Okay, so I want to consider giving this patient some analgesia. Do you have any allergies, sir? Have you been diving in the last 24 hours?
No.
Do you currently have any bowel obstruction?
No.
He's breathing normally. I don't expect he has a pneumothorax, and he's able to obey commands. So I'm going to offer this patient some Internox. Okay, so I've got some Internox here. It's a drug that will be able to help with your pain. All you have to do is just breathe on this mouthpiece here. When you take a big deep breath in, you'll probably take about 6 breaths before it starts working. You may also feel euphoric on this, or it may also cause you nausea. There you are. You may take some breaths on this. Okay, now that he's had some analgesia, I want to splint the injury. So I've got made a splint here that's going to immobilize the joints up below and above the injury. So we'll place, I'd have another crew member pick up his arm and place it into the splint carefully. Like so. So I want to, firstly before finishing off the splint, I want to assess the cardiovascular and neurovascular integrity of his arm here. So for that I want to first check his pulse. He has a pulse here, it's nice and regular. I want to check the warmth of his hand, compared to his other one, they feel about the same. He's got good colour in this hand. He also has a 2-second capillary refill in comparison to his other hand, which is the same. So that's good. Can you wiggle your fingers for me, sir? Cool, that's good. And can you feel my hands along here?
Yeah.
Yeah, okay, I don't expect any neurological or cardiovascular problems in here, so I'm going to continue splinting this now. We want to do this so to immobilise the injury and thus prevent any more injury to the arm here. Yeah. Yes, sir. We'll also bandage this as well just to further secure the splint. Is that nice and comfortable for you, sir? Yeah. Cool, that's great. I'm just also now going to assess his cardiovascular neurological integrity again, just to see if anything has changed from the splint here. So again, he's got a nice warm hand, comparison the same, he's not pale at all. He has a good 2-second capillary refill. I can feel a pulse here. Can you feel this, sir?
Yeah.
Can you wiggle your fingers for me? Cool, that's great. And that's it. Alright, so in this video we're going to be showing you how to use a cervical collar. So to do that, first we want to assess a patient whether they need to have spinal modulation. We do that with using the nexus rule. So the nexus rule will determine whether we will use a C-spine to immobilise their spine. So first of all we want to have the patient here, make sure the head's still. We want to make sure the head is between the knees here, so they're not moving at all. So, hello sir, can you tell me your name?
Armin.
Cool, and do you know where you are, Armin?
AET.
Yeah, and what time of day is it?
About lunchtime.
Yeah, okay, so cool, that's a pass. He's got a 5 out of 5 verbal score in GCS, so he's orientated to time, place and who he is. Then I will ask this patient whether, do you have any tenderness in your spine here? Check his C-spine. No, could you just keep your head still please?
Yeah.
Yep, no tenderness there. Okay, that's great. And now I'm going to do a check him over. He hasn't got any other distracting injuries that may distract him from his pain in his spine or anything like that. Doesn't appear to be intoxicated at all. Now I'll do a neurological assessment. So for doing that, I want to. Would you be able to move your fingers for me, Armin? Cool, that's great. And can you move your arms? Yep. That's cool. And wiggle your toes, please. Yep. Sweet. That's good. And can you feel this?
Yep.
Yep. And down here, can you feel that as well?
Yep.
Cool. And here.
Yep.
Yep. And then I would get my offsider to do the same to his legs. See if he's got any feeling in his legs, on his feet, and also get someone to do a Lipinski scan on his foot. And so if a patient fails any of these criteria, then we would put a collar on him. So let's say this patient has failed one of these criteria. So I would first measure the collar. So I have the collar here, I'd place it under his chin. I'd find his jugular notch, which is just over here. I'll place it there, and I want this end of the collar to sit on that jugular notch. Now I'll put this down the side, and what's important is I want to have this just touching the top of his shoulder here. So that looks like perfect size for a man here, so I'll put the block that in there. To apply this, I'll place this underneath, slide it underneath, and I want to have a lot of slack over here, so I'm able to place this over here where I want it, and then I'll push this slack underneath, do that, pull that up, make sure there's no slack on this side, and then attach that over there. Make sure it's sitting straight. Is that nice and comfortable, Armin?
Yeah.
Yep, and can you move your mouth for me? Yep, cool, that's great. So that looks like it's nice and secure. Alright, in this video we're going to show you how we do vital signs. So to take vital signs first, we want to take pulse rate. So do that by applying your fingers on the radial pulse of the wrist here. So we want to check for strength and regularity of the pulse, and then also we want to take how many beats per minute it has. So how we can do that is we can, if you watch here, count how many beats are in 10 seconds and times that by 6. Normal rate would be between 60 and 100 beats per minute. While we're doing this, we can also do a respiration rate. We want to do that so the patient doesn't know we're taking a respiration rate as their rate may change. So normal respiration rate for an adult will be about 12 to 20 breaths per minute. Cool. Now we can take a blood pressure. For that, we'll place a blood pressure cuff on the arm here. We'll find the brachial pulse. Yep. And look here. Now we want to use the stethoscope, place over the brachial pulse slightly under the blood pressure cuff, pump up the cuff until you can no longer hear the beat, and 20 over that, and then slowly let it out. And the first audible beat is the systolic rate, and continue letting it out. And the final beat is the diastolic rate. So that was about 130 over 60, and a normal for an adult was about 120 over 80, so still within the range. We can also auscultate the patients, so listen to their lungs. Use the stethoscope here, and we listen to the apex and base of each lung. So you take a big deep breath in through your mouth. So we're listening to volume and clarity of the air going through the lungs. Base. So deep breath in. Yep. And we want to compare both sides. And we'll want to listen for any abnormalities or anything like that, such as wheezing, which could suggest asthma. And we also can listen to the back as well. Alright, we've been called to a scene that someone has collapsed, so we're going to enter the scene. Alright, we see a patient here is lying on the floor. It looks to have collapsed in the middle. There's no tables, they've all been pushed to the side. There's no people in here. Unpredictable, looks like it's a lino floor, so it could be any water or anything slippery on here we may slip over on. For PPE, I've got gloves on, shoes, and so is my partner. So we're going to approach the patient. Hello, sir. Hello, can you hear me? Hello? He's got no response to my voice. Sir, can you hear me? Hello? The blind pain to his shoulder here. He's got no response to pain either. I'm just going to check his breathing. I'm going to go head to chin lift. I'm just going to listen for any breathing, any chest rise. I'm going to do this for 10 seconds. Okay, there's no breathing. Could you start compressions, please? I'm going to call for help now. AET1 to command.
AET loud and clear.
Suspected R49 requesting R50.
Roger.
Thank you. Alright, I'm going to put on the defib pads as quick as possible. You're doing really well there, mate. Just going to work around you.
Analyzing heart rhythm.
Yeah, that's
Do
good.
not
Just keep it.
touch
Okay.
the patient.
Don't touch patient.
Shock advised.
Okay, everyone staying clear. Staying clear.
Stay clear of patient.
Staying clear.
Deliver shock.
Okay, delivering
now.
shock.
Press
Delivering
the
shock.
orange button. Shock delivered.
Shock delivered. Okay, back on the chest here. Right, I'm going to insert
Start
OPA.
CPR.
Measure that here. You're doing really well there. When you do 100 breaths, 100 compressions per minute. And tell me once you get to 30 compressions, I'm going to deliver 2 breaths.
27, 28, 29, 30.
Watch for chest rise. Yep, we've got chest rise. And back on the chest. Cool, that's really good. Make sure you're doing 1/3 of the chest in your compressions there. And make sure you recoil. Cool, that's good. I'll make sure that I've got my Yankauer right next to me just in case we have the patient
27, 28,
vomit.
30.
Yep, that's good. Back on the chest. Alright, and then if you get tired, just tell me and we'll swap around, or otherwise once this reaches 2 minutes, we're going to swap around. Alright?